The Centers for Disease Control and Prevention, or CDC, funded the Denver Prevention Training Center's Capacity Building Assistance, or CBA program, for high impact prevention program integration. The CBA funding has 4 goals: reduce new HIV infections, increase access to care for persons with HIV, improve health outcomes and reduce mortality for persons with HIV, and reduce HIV related disparities. The funding accomplishes its goals through 4 separate components: national training, both classroom and e-learning, regional technical assistance, continuous quality improvement and sustainability for community-based organizations, and marketing and administrative support for the CBA provider network. Finally, the CBA programs seek to address health disparities and social determinants of health and provide culturally competent and responsive HIV prevention services. The CBA project is funded to provide training and technical assistance to health departments and their clinical partners in the western part of the United States. Welcome back, everyone. My name is Zami Tinashe Hyemingway. My pronouns are Zami, he, and him, and I'm the CBA manager with Denver Prevention Training Center, and you're one of your hosts today.
And hi everyone, my name is Miss Jai Smith. I use she, her, and he, him pronouns. I'm the CEO of Toadhenge Consulting, and I'm also an identity consultant with Denver Prevention Training Center.
We're so excited for today's episode where we're going to be talking about employment discrimination, income instability, as well as transgender and non-binary health. But for folks who did not tune into last episode, Miss Jai, why don't you give a quick review?
Yeah, sure. So our last episode, we talked about the social determinants of health. So what are they? How do they impact our lives? How do they impact our ability to be healthy or contribute to a lack of health for our communities, for trans and non-binary people? So if you haven't had a chance to check out that episode, go ahead and go to our YouTube channel for Denver PTC and check out episode 1 of Social Determinants of Health.
Awesome. Thank you so much, Ms. Jai. So before we do a deep dive into this episode, why don't we start off with some language foundation?
So first, let's define economic stability and instability. Economic stability allows people the ability to access resources essential to life, including financial resources, quality housing and food, and a job that provides a stable living wage.
Next, we're going to describe intersectionality. Intersectionality is a term coined by Kimberly Crenshaw, and it's a lens to help us see how various inequities operate and exacerbate one another. Meaning when we speak of transphobia, we also must speak to and acknowledge the roles that racism and anti-Blackness play, as well as classism, ableism, and misogyny.
Finally, let's define employment discrimination. Employment discrimination is when an employer treats an applicant or employee less favorably because of a person's race, color, religion, sex, sexual orientation, gender identity, national origin, disability, or status as a protected veteran. So in today's episode, we're going to be talking more in detail around the social determinants of health related to employment, and specifically around employment discrimination, economic instability, and the ways that these impact our health and well-being as trans and non-binary people.
So when we look at this a little deeper as to why trans and non-binary folks feel they are losing their jobs, we know that 7% believe it's due to their age, 13% believe it's due to their disability, 5% believe it's due to income level or their education. We have 30% believing it's due to gender identity or gender expression, 5% due to race or ethnicity, 2% due to religion or spirituality, 13% due to their sexual orientation, and then 61% of trans and non-binary folks just aren't sure why they're losing their jobs. So Ms. Jai, we've just looked at the statistics on trans and non-binary folks' unemployment rate and why people feel that they're being fired or losing their jobs. But I'd like for us to take a step back and really ask ourselves, how are trans and non-binary folks actually experiencing employment discrimination?
When we talk about employment discrimination for trans and non-binary people, there's sometimes this misconception that it's only happening in rural areas, that it's only happening with really conservative employers. But what we're actually seeing is that it's kind of happening across the board regardless of where you live. So 2/3 of folks who held a job, trans folks who held a job in the last year, reported being fired or being forced to resign from their position. And when we look at comparison to places like Arizona, for example, where the employment rate of trans and non-binary people is 16%, and then we look at other places that may be considered not as conservative like California, we see that the employment rate is 15%. And we see that poverty levels are consistent as well at about a third of trans and non-binary people experiencing poverty or living in poverty. And so we know that it doesn't matter where someone is living, we just know that this is what's happening for trans and non-binary people.
So you mean to tell me that the unemployment rate in rural or frontier Arizona for trans and non-binary people is just 1% difference in the unemployment rate in blue state California?
According to the research that we currently have, and this is one of the other pieces when we talk about social determinants of health, which we talked about last episode, is that we also know that our communities are there's not enough research, there's not enough information present. And so the closest thing we have to population level data is what we've already shared during today's episode, and that's because we're not counted on the census, we're not counted in these areas. So what we know and what we're seeing is that it's pretty consistent across the board, that folks are either being fired, they're unemployed, and they're experiencing poverty at high rates in the trans and non-binary community.
Wow. And this makes me just think about what's happening in these work environments, right? And so when I'm thinking about how trans and non-binary folks are experiencing discrimination, regardless of what state, city we live in, whether you're on the West Coast, East Coast, or Middle America, it has to be something happening within these agencies, right? So is it our HR policies? Is it our policies around dress code? Is it our policies around why we're even hiring folks, right? I think about when I began my career in social work and in public health, it was required to have a bachelor's, and I was doing outreach. I don't know if we really need a bachelor's to go out to folks living out on the street or go to community events and say, hey, take this flyer, right? Mm-hmm. I don't know if I need a bachelor's to do that, but a lot of these positions require bachelor's degrees, master's degrees, and again, thinking about the social determinants of health, education access is one of those, right? And so when we're thinking about employment discrimination, how trans and non-binary folks are experiencing it, we know, again, trans and non-binary folks, due to over-policing, have more police interactions, right? And that's a form of transphobia and discrimination. And so if you have a record and you have several misdemeanors, and then, you might have a felony or a misdemeanor that's turned into felony because of your record, then how are you going to get a job, even if it's an entry-level position that really doesn't need a bachelor's or higher education to do?
Yeah. And speaking of criminalization and police interaction as well, a lot of us are just stopped for the sheer purpose of being a trans person walking around, and assumptions about what we're doing in those neighborhoods, what we're doing walking around, what we're doing on public transportation. And oftentimes it's because of this linkage to, oh, well, if you're trans, you must be engaging in sex work. And if you're engaging in sex work, then you need to be policed. And so we see trans people having higher touch with the criminal justice system because of over-policing of our communities, resulting in things like ending up in a diversion program, ending up in incarceration, ending up in these spaces where other communities don't have that same experience based on gender alone.
Right, and then when we look at it through an intersectional lens, if we add on race and ethnicity, we know that trans folks of color are even more policed than the average white trans person, right? Mm-hmm. And so this makes me think about, okay, say we do our resume, say we get the job, and then we're in the organization, thinking about some of those statistics, 61% of trans folks are being fired and they don't know why. So let's take a deeper look at what these organizations, what are policies and procedures happening within the agency that might be creating an environment where trans folks can't thrive. What are some of your ideas?
Well, the first things I think of that have been experiences that I have had are things around dress code policy, right? So dress code policies oftentimes are created as a way to really control an individual in the workspace and impart this idea of professionalism upon them. And so what has happened for me is that I have worked in environments where a dress code policy is present and the dress code policy isn't the same for cisgender men and cisgender women. And so there might be an expectation of like, okay, well, men have to wear pants and button-ups or polos, and women have to wear skirts or pants and a blouse that covers some amount of the body, right? And so if I show up in a skirt, I'm going to experience a dress code violation, or I'm going to be told you're out of dress code or you're not following dress code. And this has happened to me before where this has come up. And that is when the policy is violated. Because this policy is in place, it's also giving permission to my colleagues to be able to make comments about what I'm wearing and how I'm showing up in the workplace. So I've worked in hospital settings where I've had physicians laugh at me because of what I'm wearing. I've been in hospital settings where I'm working on a floor with folks from different departments, and they're actively making fun of the way that I'm showing up to work because I'm just showing up to try and do my job. And so that is a way that this policy then permeates the culture. And so this is a way that that policy becomes employment discrimination as well. And that's just one policy. That's dress code.
Right. And I want us to talk about dress code even more so because, in all honesty, it seems like the dress code violation really has nothing to do with what you're wearing because you are wearing clothing that's described really for femme-identified folks, but they're just calling it for women, you know. And it seems as though you're being punished based off of your gender expression and your identity as opposed to a true violation of the dress code, right?
Yeah, absolutely.
You know, and something else I want to say is I feel that when dress code policies are created, many people forget why we create dress code policies. For example, you worked in a hospital, you said. When we have dress code policies in the hospital, it's usually around safety. You know, and so it's really about safety. And it'd be different if someone was saying something about jewelry that's too long, or maybe you're wearing, your nails are too long and you can't perform your duties, right? You know, those are actual dress code violations because they create a safety hazard. But whether or not you wear a dress or a skirt, as long as it's appropriate length and it's not revealing too much clothing, then it shouldn't be an issue, right? And again, when it comes to intersectionality, I know I've worked for companies that their dress code policy was no mixed patterns and no bright colors. I might be in violation today.
I'm in violation every day.
You know, but when I think about that, say I wanted to wear a dashiki to work, they would have told me that that was violating dress code policy because it was mixed patterns and bright colors. I think about trans women who may be Native American or indigenous. If they wanted to wear their tribal clothing or clothing that represented their tribe, they would be in dress code violation because it'd be mixed patterns or bright colors. And so these are different ways that we institutionalize or create policies and procedures that actually push trans and non-binary folks out and create discrimination through the work environment that really aren't needed.
A question for you, Zami. How does economic instability create barriers to healthful living?
Awesome. Yeah, this is a great question, Jai, because I think when people first think about economic stability, they mostly just think about whether or not people can have a job, whether or not we can afford like different things, but it really has a larger impact over our overall ability to have a healthful life and really thrive and optimize our health, right? So two of the things I first think about is housing. So across this country right now, we see that there's a housing scarcity, that rent is going up in apartments, that folks who are renting houses, that rent's going up, property taxes are going up. And so if we have economic instability, then we're not able to pay for basic things like our home, right? And so places that across this country were usually really affordable are now priced at the same rental property rates as somewhere in like California, right? And so folks are moving more Midwest, they're moving more to the South, they're moving all these different places that supposedly have a lower cost of living. But when we start doing this migration, we see that what also travels with us is higher rent and property taxes. And so for trans and non-binary folks who already are underemployed, already have financial instability, we see that this housing crisis for our community just increases even more so, right? The other thing I think about is food scarcity. So we talked about in last episode that sometimes what happens in our community is we have to decide whether or not we're going to pay for food or we're going to pay for medication, right? Or we're going to pay for rent. So if you have housing scarcity and you have to decide whether or not you're going to pay rent or pay for your health care, that also means you have food scarcity and trying to figure out whether or not you're going to buy this thing that's $1, this top ramen, that it has lots of sodium, really no nutrition, or are you going to spend $6 on maybe some fruits and vegetables? That's outrageous and usually is really unaffordable for many folks in our community. So we see how economic instability and being underemployed really impacts basic needs for members of our community, and really just does a disservice and creates this huge barrier for us to be able to optimize our health.
Yeah. I think a lot about the access to care pieces again. So we know that if we're not able to get in for medical care, if we're not able to have regular access to medical care, if we're not able to get preventative screenings and testing and treatment, that our health conditions are going to get worse. And we talked about this already with chronic conditions and the ways that our bodies really hold on to this, and it snowballs into something more intense. So I think about how financial security and how finances can mean that it's harder for us to even get to a physician's office. So if we're living in a rural or frontier area, we might not have public transportation that can get us to our physicians. We might not have access to phones and things that allow us for telecommunications to be able to see our physician, or internet service so that we can jump on a web call with our physician. We are seeing an increase in the cost of public transportation. We're seeing an increase in the cost of transportation in general. So if we were previously driving our own car, it might now be unaffordable for us to fill our gas tank. And so like that alone is making it harder for us to have our health needs met. And then if you add on top of it the cost of medical service. So if we have co-payments that are unaffordable, if we have services that we find out after the fact are not actually covered because we went out of network and didn't realize it, or because we got a service that actually is not a covered service, or we don't understand our health insurance because we haven't been taught to understand our health insurance because it is complicated. And so financial insecurity means that we are then afraid to get our health services because we don't know what the bill is going to be, or that the bill itself becomes uncontrollable and suddenly we're in medical debt up to our eyeballs and we're trying to figure out what to do with this. And so every time we hear that, we become afraid of getting more medical services or getting our health needs met.
Right. You know, Ms. Shai, so I want us to circle back a little bit to transportation. So I'm thinking about, you know, when we think about transportation, for example, oftentimes we think about rural, urban, frontier, maybe some frontier areas, but I also think about our indigenous trans siblings, right? And so thinking about what does telehealth look like on a reservation or on a pueblo, right? Do they have enough, different electricity? Do they have a reliable internet access and services? And I know many reservations and pueblos do have their own Indian health services, and sometimes that also requires folks to travel into the city. And so does the public transportation actually reach the pueblos and reservations for our Native American or First Nations trans siblings, right? Also thinking about telehealth, and are the telehealth services reaching out there as well? You know, and looking at some of frontier and rural areas, they may not even have reliable internet services either. And so when we think about access and transportation, thinking about those push further too, right? A lot of telehealth services, a lot of public health transportation really is focused on suburban areas, urban areas, and if you are in a poorer area, then you might have to go miles before you even get to a bus stop. So Ms. Jai, we just identified some of the barriers to trans and non-binary folks having a healthful life or healthful living. Why don't we go a little bit deeper and identify how do these barriers actually impact the outcome of our health?
Yeah, so we talked about the barrier, for example, of finances as it relates to access to medical care, right? So challenges with having internet, challenges with seeing your physician. When I think about how this impacts our health as trans and non-binary people, one of the first things that comes to mind for me is, are we able to access the services? Are we able to access the information to be able to learn how to prevent an infection, to prevent HIV, to prevent hepatitis C, to prevent STIs, as one example. And so I think about in the work that I have done, oftentimes that information is available on a web page. So for additional information, go to the web page. To access a site near you, to go to the web page. To set up for vaccination for Mpox, go to the web page. Like, these are things that we institutionalize in this way or put together in this way. And it means that the health outcome from that, because I don't have access to those things because of financial insecurity, means that I'm not going to be able to get vaccination. I'm not going to be able to learn about how to prevent this infection, or learn about PrEP, or learn about PEP. And so I'm more likely to seroconvert. I'm more likely to get HIV and not be able to prevent or catch it post-exposure. I'm more likely to experience STIs that go untreated. I'm more likely to not understand what might be going on with my body in these moments. And so it starts to impact and create these chronic health conditions that we talked about a little bit in the first episode.
Yeah, absolutely. And some of the things I'm thinking about is we live in a digital age, right? So everyone has some sort of smartphone, or at least that's the assumption that we all have smartphones, right?
Mm-hmm.
And so thinking about that, okay, everyone's saying, well, if I hand them a pamphlet, they're not going to take this pamphlet, so why create it? We're just going to create this digital resource. But you bring up this great point that even if folks might have access to the internet, even if they might have access to a smartphone, what about they can't pay their bill because of economic instability and underemployment? What if they are living in a rural area and the only time they have reliable internet is when they get closer to the city, right? We have to think about some of the nuances and the ways that honestly technology has failed us, right? And then the other thing I'm thinking about is how you said information, right? There's so much information out there, but there's also so much misinformation. So thinking about preventative measures, we talked about PrEP a little bit in episode 1 and how many trans and non-binary folks get misinformation around PrEP, And so some of the information isn't just telling someone about pre-exposure prophylaxis, but also talking about PrEP and hormones. Answering some of these questions around whether or not PrEP impacts hormone replacement therapy, which it does not, which is a misconception, right?
Yeah.
It does not. You can be on hormone therapy and you can use PrEP. Also thinking about when trying to prevent things such as Hep C, doing education around needles and needle exchange when it comes to hormone injection. We know that if someone's experiencing economic insecurity, they might share needles, and not necessarily to use substances, but to use prescribed substances such as hormone treatment.
Absolutely.
And so our community has to find ways to survive and thrive, and often that means doing some things that it doesn't usually optimize our health. And so when thinking about Hep C prevention, that also means talking about how do you do proper needle exchange when it comes to hormone treatment? How do you reduce the risk of getting an abscess when you are using your hormone treatment? And giving information around preventative measures for trans and non-binary folks that you don't just get on the internet, but you can also find in a pamphlet.
And I also think about, to some of the other barriers you mentioned earlier, housing and food insecurity. Those are going to have direct impacts on our health outcomes as well. If I'm unstably housed, if I'm couch surfing, or I'm completely unhoused and I don't have protection from the elements, then I'm going to experience health conditions related to exposure to my environment. I might have heat stroke. I might have challenges with heat burns and things like that. I grew up in Arizona where it becomes incredibly hot during the summertime. And so this is a direct impact to our health outcomes. Food insecurity means that we're going to be buying things that are less nutritious, right? So we know that this has a direct impact on the development of chronic health conditions for trans and non-binary people. We also know that that this, in combination with the other aspects we've talked about, the inability to get access to a health provider, discrimination when we are experiencing health care, employment discrimination, making it harder for us to have the financial wherewithal to be able to do these things. This all creates sort of a perfect storm of poorer health outcomes overall for us as an individual and our community.
Absolutely. And I'm just thinking with this one thing about how oftentimes when folks say, well, this community member is homeless, or this population has a larger experience of being underhoused or homelessness, well, why don't they just go to a shelter? Well, the reality is for trans and non-binary folks, we can't access shelters because it's not going to be safe for us if we are trans masculine folks. What shelter are we supposed to go to? We can't go to men's shelters because that puts us at risk for assault and violence. We don't go to women's shelters because many women will feel uncomfortable with our presence because we look more masculine. The same for trans women and non-binary folks. What shelter should they go to? And also thinking about identity documentation, right? many trans and non-binary folks don't have identity documentation that actually is in alignment with our identity and our name. And it's not just because we don't want to change our name or our gender marker, but we don't have the finances to do it. So everything keeps going back to financial stability, underemployment, and how these resources that we need to be able to access services, have basic needs met, often is not accessible to us because of financial instability. And really just the way that transphobia shows up throughout our institutions, throughout our society, and really is sanctioned.
Yeah. And the one additional thing that this makes me think about is that if I'm experiencing housing instability, I'm experiencing instability financially, I'm experiencing challenges with finding a job, that's all going to weigh on my mental health. And so I'm going to have increased challenges with anxiety, increased challenges with depression, these underlying things that might just be low level for me now suddenly are going to be very much brought to the surface because there's so much happening that feels outside of my control as well.
I'm so glad that you brought up mental and behavioral health, Ms. Jai, because we know that in our community, 62% of trans and non-binary folks experience depression or have been diagnosed with depression, and 42% or 41% of trans and non-binary folks have experienced suicidality. And again, thinking about episode 1, we know that trans and non-binary folks, we have a higher mortality rate than our cisgender counterparts due to chronic illness, due to depression, due to psychological distress, and a lot of the other health outcomes and barriers that our community experiences due to the social determinants of health that we've been discussing.
So we've covered a lot today in the episode. If you are watching this and you enjoyed today's episode, if it was helpful, if you learned something, go ahead and like, subscribe, share this with a colleague as well. And join us for our next episode of this series where we'll be talking about talent acquisition, retention of trans and non-binary staff, and how that all relates to our health and well-being.
And if you or your organization would like more support and resources on how to support transgender and non-binary people in your health department, clinics, or community-based organizations, go to www.denverptc.org, and we'll be more than happy to set up a meeting.